I had this very vibrant 63-year-old woman walk into my office one day. So we do an initial consultation that is complimentary as well, because we want to make sure we have a chance to hear your story, understand your goals, and make sure that we're the best fit for you. Because if not, we want to help you navigate the healthcare system so you can get where you need to go. Now, this woman was crying as she looked at me and said, "Can you help me?" A year ago, she had been in a horrific car accident. We are talking 4 days in the Harborview ICU after she got in medevac. 2 months after that, in the hospital. And 2 months after that, after getting out of the hospital, in rehab, learning how to walk and do daily activities. Horrific. A year after the accident, she went to her final checkup with the doctor at Harborview, so the initial person who had taken her in. Follow up, make sure everything's good, and because it's a car accident case, like we got to close it up and all that stuff. This woman had daily pain that kept her from doing anything other than the essentials. Like, she could get out of bed, she could go to the bathroom, she could eat food, but that was it, because she was living in chronic pain. And she looked at the doctor and she's, "Hey, listen, can you do anything to help me?" And he said, "This is as good as it gets. You should be happy that you're alive." Now, friends, obviously she was happy that she was alive, okay? Obviously she was very grateful for all the help that she had received. But she's crying, looking at me saying, "Can you help me?" And I was like, "Of course I can help you. And your bones have healed." She had fractured multiple ribs. She had fractured her pelvis. She had punctured her lung. I'm like, now that's all healed, right? Because I don't do that stuff. Fractured ribs, punctured lungs, I don't do that. That's all healed, right? She's like, "But I have pain." I was like, "Well, if you have pain, that means it's soft tissue. That means it's muscle, it's ligament, it's fascia." That's what I do. Now, I can tell you it did take a while.